Depression affects the person's entire world, whether it's having a romantic relationship, friendships, or holding a job.
The symptoms of a major depressive episode include having a persistent low mood for at least 2 weeks, and it exists almost every day. Difficulty with sleep, whether it's too much or too little. Not being interested in things that normally interest you, which we call anhedonia. Having an excessive sense of guilt or hopelessness. Having very, very low energy. Having difficulty focusing. Having changes in your appetite, which could either mean eating more or less than usual, feeling incredibly slow, or what we call psychomotor retardation, or feeling sort of keyed up, which we call psychomotor agitation, and finally having thoughts of wanting to harm oneself or suicidality. To qualify for a diagnosis of clinical depression, the symptoms have to be present for 2 weeks, and they go on mostly every day.
We don't really always know what chemically exactly is causing depression, nor where in the brain that is happening, but we do know that serotonin is probably the predominant neurotransmitter or neurochemical involved in depression.
We all have these brain chemicals called neurotransmitters which help us to function. People that are feeling depressed have a harder time. Their systems are not regulating those brain chemicals as easily. There's also some research indicating that people that are depressed have differences in their brain structure. Their white matter in their brain is structured somewhat differently.
Some of the risk factors for experiencing depression include a personal history of experiencing a major depressive episode, a family history of somebody else having a major depressive disorder or another mental health disorder, one's own history of another mental illness such as anxiety disorder or a substance use disorder, and a particularly stressful life event, which could be a move or the loss of a loved one.
Depression is really painful. It's a real struggle. It's because it's not logical, and it doesn't matter what you look like on the outside, because my life is really, truly in Technicolor, and yet it feels black and white to me.
It can happen with no trauma and nothing stressful going on in your life, and that's important because some people are like, what's going on? My life is wonderful. Why do I feel this way? I shouldn't feel this way. There is a biologic process going on. It's an illness. They can't control it. They really need treatment.
If you ever feel like you might want to harm yourself or somebody else, please call 911 immediately or proceed to your nearest emergency room. It's also good to have on hand the National Suicide Prevention Lifeline, which is 1-800-273-8255.